Good morning, everyone. Good morning. If I could have your attention. So, first of all, I just want to thank everybody for coming today. What an amazing time. I've been having so much fun just going around and talking to so many friends and people from around the state and from beyond, well beyond. And I just thank you so much for coming. And speaking of people from beyond, those from away, I just want to let everybody know, if you're from away, the weather we have today is exactly how it is in Maine every day. This is what we have. So it's always like this, just so you know. But in all seriousness, thank you all very, very much for coming out and helping us celebrate this truly momentous occasion. I'm especially grateful to be joined by the Harold Alfond Foundation Board Chair, Greg Powell, who I'll introduce momentarily, and also Peter and Paula and Margie Lunder, who are here with us in the audience today as well. Thank you very much for taking the time to be with us. And thank you also to the many, many local dignitaries from the state. There's so many people, and in fact, I initially started making a list of all the people to acknowledge personally, and it got way too long, and I would be keeping you here for a half hour just going through names. So you know who you are. I'm not going to call you out individually, but please, that's not a reflection of my lack of appreciation. It's just we don't have time because there's so many people who've been important to this project, important to UNE here in the audience today. I'm also, yes, thank you. Thank you to all of you. I'm also welcomed today by colleagues from UNE's senior leadership team, the faculty, the professional staff, and most importantly, it's so nice to see some students here because, after all, this building was conceived and constructed for the students, ultimately. So, friends, today we open the Harold and Bibby Alfond Center for Health Sciences, a facility that solidifies UNE's Portland's campus for the health sciences as one of the premier health education hubs in all of New England. With the opening of this building, we position our medical students side by side with nursing students, physician assistant students, future physical and occupational therapists, pharmacy students, future dentists, and many other health profession students here in Portland on this campus. It situates Maine's only medical college amid the growing healthcare and bioscience communities in Portland. But the impact of this facility will reach far beyond Portland to impact the entire state of Maine, including its remote rural regions, and indeed throughout New England more broadly. It increases the number of doctors we can graduate each year at a time when their expertise is desperately needed in the communities we serve throughout the state and the region. It supports the work of all of our health profession students by allowing us to strengthen our already renowned programming in collaborative, team-based interprofessional healthcare education and science. And it frees up space on our Biddeford campus, just a half hour south from here, to help us expand our undergraduate programming there to meet critical workforce needs in Maine and throughout the region. As many of you know, this project was a long time in the makings. When I arrived to UNE in 2017, one of my very first conversations with the leadership and with the board at the time was that during the process that would eventually bring me here, is I remember wondering out loud, why is the medical school located in Biddeford, smack dab in the middle of a residential undergraduate campus, when the rest of UNE's health profession programs were here in Portland? Upon joining UNE, I knew that it was imperative to unite our medical students and the other health profession students on the same campus. But I knew that making that vision a reality would take a monumental effort, and it would take buy-in from a wide range of stakeholders. I could not have asked for a more supportive, diligent, and committed team of partners, both internal and external, to help us arrive to where we stand today. This beautiful building would not be possible without the Harold Alfond Foundation's $30 million commitment in 2020. That incredibly generous pledge, the largest in UNE's history, provided us with the institutional support necessary to build out our larger campaign, the Doing Our Part campaign, which so many of you that are here today have supported, and I'm deeply grateful for your support. Thank you, Greg, Thank you to the Alfond Foundation for the impact on UNE and across Maine and the efforts that are positively shaping our state for generations to come. Maine's senior senator, Susan Collins, was another essential partner, helping us secure a $5 million federal appropriation for this facility. Senator Collins' schedule precluded her from being here with us today, but we thank her so much for her partnership and support on this project, and also her partnership for the many other areas where UNE's mission and the state of Maine's needs align. Dean Jane Carrero, who leads the College of Osteopathic Medicine, was another essential ally. Jane, you were instrumental in helping us get buy-in from our COM leadership team, our faculty, our students, and our alumni. Thank you. And UNE Vice President for University Operations, Al Tebow, was another vital partner in the project's planning and development, spent many sleepless nights planning and executing this project. So thank you, Al, for your help. And so many other members of our Nor'easter community supported the project in one way or another. You know who you are. You know how you helped to move us closer to the moment we celebrate today. And I hope you share the pride of accomplishment that I feel today. I'm grateful to have the partnership of each and every one of you. Together, we've done something that will positively shape UNE and Maine's future for years to come. Over the past 2 decades, UNE has emerged as a unique institution to the health of our home state, acutely attuned to the industry needs and providing wave after wave of graduates who are expertly equipped to tackle the latest workforce needs in Maine. When the history of UNE is one day written, this day, the day this transformational building opened, will be remembered as an example of how this university carried out its mission, how it expanded its impact, and how it improved the lives of people in Maine and throughout New England. Fellow Nor'easters, we did this together. I can't wait to see what this building does for our students, and I can't wait to see what we're going to do next, so stay tuned, because more's coming. Thank you all for supporting this project in the various ways that you did. Thank you for your continued partnership as we lead UNE and Maine into a bright future. And it's now my pleasure to introduce UNE Provost and Vice President for Academic Affairs, Gwen Mahon. Thank you. Gwen?
Got to move that down a little bit. Thank you, President Herbert. This is truly a historic day for UNE. As President Herbert said, this beautiful new facility is going to change the lives and experiences of our medical students. But with the move of UNE's medical school to this unique campus, the Portland campus for the health sciences, the learning experiences of all of our health profession students is going to be transformed. At UNE, we pride ourselves on being leaders in interprofessional education, also known as IPE. This practice intentionally brings students from different health disciplines together to learn from one another, to diagnose and treat patients collaboratively, and to ultimately work as a unified healthcare team. We have made great strides in this work, but now, with all of our health professions together on one campus, we will be able to fully integrate the preparation of future physicians with future nurses, pharmacists, physician assistants, dentists, and the list goes on. Studies show that when healthcare providers work in teams, their patients have improved outcomes, and the incidence of medical errors are greatly reduced. So on behalf of all the health programs here at UNE, I want to say thank you to everyone who supported this project and who made today possible. It is now my great pleasure to introduce Dr. Jane Carrero, Vice President for Health Affairs and Dean of UNE College of Osteopathic Medicine.
Welcome, and thank you all for being here. It's so nice to see so many faces. This is an incredible day for UNE's College of Osteopathic Medicine for our students, our alumni, many folks in the audience, faculty, and professional staff. It's also an incredible day for Maine's medical community. The UNICOM is Maine's only medical school. More Maine doctors are educated at UNE than anywhere else. And with this new facility, we will now be graduating 35 additional doctors every year. That means 200 doctors entering the medical workforce each year at a time when Maine, Northern New England, and the nation desperately need more physicians. We know that we have a special responsibility to Maine and its communities. The people of Maine welcomed us when we started, and they depend on us to educate their future doctors with the knowledge and skill to provide the excellent quality of care that they deserve. And we are very proud to deliver that. Our graduates rank in the top 10 nationally on their licensing exam, and more than half of them choose to practice primary care, where their expertise is desperately needed. Others go on to practice in the full range of medical specialties, orthopedics, cardiovascular surgery, obstetrics, etc. The students joining us here today represent our future. They have passion, dedication, intelligence, and skill, and as Dr. Herbert said, this building is for them. The new facility was built for them and for the students who will follow. It will take the world-class preparation UNE provides to previously unimagined levels. As you heard from Provost Mahan, it will also allow our students to learn in collaboration with UNE's many other health profession programs, and to better connect with the many hospitals and healthcare professionals in the region. I want to echo President Herbert's thanks to Mr. Powell, the Alfond Foundation, and the many, many individuals who made this shared vision for the next chapter of UNICOM a reality. And now I'm pleased to introduce the chair of the UNE Board of Trustees and also a UNE alumni, Dr. Regan Gallagher.
Good afternoon. Thank you so much, Dr. Carrero. As you have heard many times already, this is a special day for UNE and for the future of health in Maine. It is also a special day for me. As an alum of UNE's College of Osteopathic Medicine, I deeply appreciate the foundation that this medical school was built upon. The way the college has responded to the health needs of Maine by producing increasingly more doctors in both primary care and needed specialties. And now, the way the UNE is embarking on a new chapter of medical and as Chief Medical Officer for Cary Medical Center in Caribou, in Maine's northernmost county, I see the challenges of our state's shrinking medical workforce firsthand. I know how hard it is for Mainers to find a primary care physician or a doctor, and especially when they need care. Every year, UNE sends medical students and students from other health professions to Cary and other clinical sites in rural areas around the state. Through clinical rotations and experiential learning opportunities, UNE intentionally exposes its students to rural health care throughout their time here so that students can experience how fulfilling a career serving an underserved community can be. And that approach works. 40% of graduates practicing in Maine do so in rural or underserved communities. This new facility is a testament to UNE's investment in Maine and to the health of our nation. I am so proud to be a graduate of this institution and to continue to serve UNE's mission as its board chair. Thank you, and congratulations on this exciting milestone. It is now my pleasure to introduce Greg Powell, chair of the board of the Harold Alfond Foundation.
Well, it can't be Saturday because it's not raining. What a pleasure it is to be here at this absolutely spectacularly beautiful building and with all of you, and to be here together on such a wonderful occasion when there is so much turbulence and discomfort in the world right now. I don't know about you, but with all of the news that's coming on down every single day, I get very confused. And I've heard that the president wants to purchase Greenland and annex Canada. And frankly, on UNE's budget, I don't know how President Herbert's going to do that. So anyway, but if anybody can, James Herbert can do it. I just want to say that, well, how about this, folks? Will Rogers was known to say, "It ain't bragging if it's true." And what we have heard from the university's fine leadership is not only true, but inspiringly hopeful for what the future of UNE will mean to the people of this state and beyond. In Biddeford, where UNE was first originated, and here on this campus, the people of this university have dedicated themselves day in and day out to providing high-quality, job-relevant education. Education that deliberately and creatively prepares students to meet the healthcare and other workforce needs of our state. With the superb leadership of your president, who is going to be buying Greenland, your provost, dean, board, faculty, and staff, you are a winning team. And Harold Alfond loved nothing better than a winning team. So on behalf of the foundation, let me thank all of you here today who have made the construction of this beautiful building possible, but more importantly, for the vital work you do. When I think of this university, I am back in time some 30 years ago, feeling the hope and promise of UNE as Harold Alfond and I visited the Biddeford campus. Harold had just made his first grant to UNE to help build the first Alfond Health Science Center, a much-needed new home for the medical school and expanding health science programs. We were there to check up on the investment, and we were there on an unannounced incognito visit. No university president around. We locked the checkbook up back at the office just in case we ran into somebody. But it was springtime, and as we rode through the campus, we could see the budding leaves ever lightly filtering the blue tapestry of the Saco River and the Atlantic Ocean. And we could see the expanse of land on that campus over which soon the old medical school building was going to be replaced and a new one was going to rise. We could see students walking briskly and makeshift, believe it or not, classroom trailers dotting the landscape. 30 years ago, we could imagine that the first health science center of this university, it was rising, overlooking the river mouth, the ocean, the playing fields, and distant cottage rooftops of Hills Beach Road. And we could feel the hope and promise of UNE. This all was something very special, a university in the making with a great mission. As we rode along, we thought about that mission, and for Harold, the mission had a special meaning, as he described starting his first shoe business in Norridge Walk, Maine. Then a young man. He recalled falling seriously ill, but he said he was lucky. He was lucky because there was one family doctor in Norridge Walk, a Dr. Joseph Eshelman, an osteopathic physician. The doctor took care of me, Harold said. He pulled me through. So as we gather today to celebrate the opening of this beautiful new center, we can know that the roots of the foundation's support for UNE run deep back in time to the youth of Harold Alfond, and we can know how healthcare in a rural Maine town made a difference. If you'll indulge me, from Norwalk Shoe and forward, Harold lived a wonderful life. He found the love of his life, Bibby, fathered 4 fine children, started a Dexter Shoe Company with his partner, who is here with us today, Peter Lunder, launched the first charitable foundation in Maine, taught his children to give by giving, and at his passing, gifted his entire fortune to his foundation. Since that visit, some 30 years ago, the hope and promise we felt for UNE has blossomed, one milestone accomplishment after another. Within a year of that visit, this stately Portland campus was acquired by UNE in a merger with Westbrook College, setting the stage for the university's growth in graduate healthcare programs, research, and more. There were no centers for research at UNE when we visited that day. Today, there are 8 with millions of dollars expended annually for research. Science research with strong student participation has expanded and deepened, ranging from understanding pain and its origins to the development of cutting-edge models for interdisciplinary healthcare, as we have heard the dean describe. Since that visit, student enrollment has grown from some 1,200 students to 6,000 students and another 5,500 online. Nearly 12,000 students we're talking about here. After that visit, the university opened the first and only college of pharmacy in Maine. 4 years later, UNE launched the first college of dental medicine in Maine's history. And since that visit, some 30 years ago, UNE has produced over 16,000 healthcare professionals, including over 3,700 physicians. Those doctors, some 60% practice in primary care. And as Dr. Gallagher has noted, some 40% of those doctors serve rural areas like Norridgewock, where Dr. Eshelman pulled Harold Alfond through. What a history. 30 years of investment, 30 years of blossoming accomplishments, 30 years of a great university in the making. So, on behalf of the foundation and the Alfond and Lunder family, we are deeply honored not only to have this beautiful new center bear the names of Harold and Bibby, but grateful for all you have done and all you will do for Maine in the days to come. So thank you. Much has been written and said about Harold Alfond, but let me leave you with this. Bibby Alfond was born in Waterville, Maine, to a family of 8 children. She was the youngest, and as such, as her older siblings, she became known as Bibby, meant with affection to stand for the baby of the family. In her lifetime, she was not only a staunch supporter and partner of Harold and his career, but a pillar of her community, providing support and counsel to those in need. In the written agreement memorializing the very first charitable foundation in Maine, the Harold Alfond Foundation, her signature stood astride that of Harold's. Though her legal name was Dorothy, she carried the name Bibby through her life. For those of us fortunate enough to have known her, the name seems so perfect because, like a baby you cannot help but love, Bibby's unconditional love for others was the hallmark of her being. In her lifetime, the health care that UNE looks to advance through all that it does was not always there for her. Yet through all her life and through all her health challenges, her love, values, and support for others, for Harold, for her family and friends, never waned, never faltered. Now, President Herbert sent me an email, and he's told me that the name of this building is a mouthful, which of course it is, and that our medical students have taken to calling the building a shortcut. They call the building the Bibby. Just look at it, isn't that it's the Bibby? Well, let me close with this. Bibby's family loves that shorthand name for this building, as they know Bibby would love all of you, not just for all that you have done and will do for healthcare in Maine, but for just plain being you. That was her way. And here on this campus and in this beautiful new center, the mission of healthcare will be the way of UNE. And we are hugely grateful for all of that. Thank you, and congratulations.
Thank you so much, Greg. And now for the big moment. So we're going to cut the ribbon, and then I invite all of you to join us inside for a toast and also for tours of the facility. And again, thank you all so much for coming. Okay, the big reveal. 2, 3. Please join us inside.